While working at a pain center in 1990 at St. Luke's Hospital in Bethlehem, Pennsylvania, psychologist and former nurse Sarajane Williams began using live harp music with a Genesis Vibrotactile unit for patients who suffered from chronic pain, stress, anxiety, and depression.
Prior to that time, only recorded music and tone generators had been used to provide vibroacoustic therapy, primarily in Scandinavian clinics.
Patients who receive Vibroacoustic Harp Therapy, VAHT, frequently report a decrease in pain by an average of 3 points on a subjective 1 to 9 rating scale after a 20-minute session.
The human body is made up of about 75% water, so sound moves through the body similar to the way water ripples into fracks when a pebble is dropped into water. Vibration stimulates metabolism and circulation. It interrupts nerve transmission among pain pathways. It stimulates and relaxes the central nervous system, and it balances chi energy. Hundreds of case studies indicate that vibroacoustic harp therapy may be a very effective treatment for fibromyalgia, other chronic pain conditions like reflex sympathetic dystrophy, migraine headaches, insomnia, pain and tension that you may generally feel from other diseases. It's a great antidote for stress, anxiety, and depression. Each session and each patient is unique. Some people experience profound emotional catharsis, and then there are other people who just quietly relax and listen to the music and feel the vibration on their body. They may even fall asleep.
My name is Dr. Susan Dallas-Feeney. I'm a family physician and I practice in Westchester, Pennsylvania. I decided to pursue a postdoctoral degree in integrative medicine, and I had to do a thesis, and I decided to choose for my project, my thesis project, the effect that vibroacoustic harp therapy has on heart rate variability. Sarajane and I had 9 patients, and we analyzed their baseline heart rate variability and blood pressure and pulse rate prior to being exposed to the vibroacoustic therapy. And then we actually continued monitoring them throughout with the heart rate variability monitor. And then when the study was over, we did it post-therapy. And it clearly showed normalization in all of the subjects. I might also note we did follow up on how people responded to the treatment the next day and several days later, and some of the patients did have profound improvement in their emotional and psychological symptoms and pain also after they were exposed to the vibroacoustic harp therapy. It sustained, actually carrying into following several days afterwards.
Vibroacoustic harp therapy is performed by attaching an adhesive microphone called a pickup to the inside of the soundboard of the harp. That is attached to a stereo amplifier, and then the amplifier is attached to the chair, which has speakers embedded in the chair. The patient is asked to assess their pain level before and after the session on a scale of 1 to 9, with 9 being very tense or painful. We also create a body map when I ask the patients to tell me where they feel the resonance in their body with specific frequencies. And that way I will know what notes to use when I improvise music that's tailored to their needs. This is a brief demonstration of vibroacoustic harp therapy.
I'd say pain level not severe, just more like tension between my shoulder blades and neck. And just dealing with trying to come back into balance after being stung by an insect and having lots of inflammation in my face. And actually I feel the inflammation in my muscles coming out. I don't know how to describe it.
Okay, just let me know where you feel the resonance in your body. Where do you feel that?
Feel that in my middle.
Low tones are usually experienced in the denser tissues of the lower portion of the body.
Both legs. It started from the middle of my spine and went down both legs. My whole bottom half of my body. That one I felt like a sort of an opening that went down my arms.
Higher frequencies are often felt in the head and hands.
It's really like, I don't know, like I feel like a circle here. I don't know. And that one's almost coming higher above me. I think the most noticeable change was, at some point, was this sort of like a heaviness on my chest, my upper chest, kind of like, felt like it flew away. And then I realized that it was the fear that was there from being in the emergency room from this insect sting. And then it kind of just lifted and went away. And so that was really, really sweet. I think that's the most noticeable change right now. Although I actually, overall, my shoulders do feel more relaxed and overall more happy. My toes are happy too.
Controlled studies need to be done. However, the anecdotal evidence about the benefits of vibroacoustic harp therapy are overwhelming. I've had some really amazing results with a few individuals. For instance, one woman had a 5-minute demonstration of vibroacoustic harp therapy. She had 3 toes that had been paralyzed from a previous back surgery 3 years earlier. And we did a 5-minute demonstration, and she felt the sound course down her leg to her toes, and that was the first time that she had sensation in those toes in 3 years. By the end of the session, she was able to move the 3 toes, and 2 weeks later she reported that she still had sensation and movement in her foot and her toes. So those kind of results are very unexpected but profound. Vibroacoustic harp therapy is the perfect paradigm for energetic or vibrational medicine.
My name is Robert Rochman. I'm a clinical neurologist in Allentown, Pennsylvania. In particular, I've been very interested in patients with headache, ADD, myofascial pain, post-traumatic stress syndrome, sleep issues, patients with anxiety disorders and depression, and how they all relate and interrelate with each other. The use of vibroacoustic therapy in a patient that's in chronic pain, often from head to toe, or that's been in chronic pain for any length of time, when they sit in the vibroacoustic chair and the therapist plays, it may localize the patient's pain for the first time, where they haven't been aware of the origin of their pain or where it's really localized to. And that may also identify the emotional origin of the pain, where that had not even been a thought before. So it can separate, identify, and correlate the basis of some of their discomfort. Because we get into their emotional memory and their remote memories of things that are good and bad. We can get them to distract and distort and dissociate so that we can alleviate their suffering. We stimulate the brain's neurotransmitters, and we utilize the dynorphins and the opioid systems so that we change pain and modulate pain mechanisms, and through that we create the body to be able to, and the individual to be able to have a sense of well-being, to relax. It's interesting that with pain modulation, sleep becomes more regulated. Patients in chronic pain or anxiety from sleep deprivation or sleep fragmentation, the vibroacoustic therapy has been very helpful, and allows what I do as a neurologist and a pain management specialist to be much more easily accomplished.
According to the latest research in the field of psychoneuroimmunology, receptors in the cells of the body are activated by specific frequencies and their higher harmonics. These frequencies, which fall within the audible sound range, affect cellular activity in the same way that peptides, drugs, or emotions would.
The first Vibroacoustic Harp Therapy training course was held in 2006.
2 years ago, with Claire Diamond, I met Ian. He came back from Salt Lake City, all excited, and was talking to us about Sarajane Williams, who was doing Vibroacoustic Harp Therapy. Well, I must say, I was all excited. My family is a musical family. I've been in practice now 33 years in medicine. My name is John Fairfield. I'm Chief of Staff at the hospital here in Hawkesbury. I was excited enough to look into the possibility of bringing this therapy to our hospital. And fortunately, we had a group of physicians around us who did not resist to the idea, were quite excited themselves. And although it took some time because we understood very early, and I remember that gulp when Ian informed me and Claire informed me that you had commented on the fact that we'd be the first hospital, not just in North America, but in the world, attempting to have a program in harp therapy in a hospital. We decided that we'd have to look at this closely. And we finally came up with some pretty good ideas about how patients should be informed of the rare possibilities of complications, the possible benefits they'll get out of this type of therapy, and we established also what contraindications there should be to this therapy. And here we are. Ian, years ago, came to the hospital on every Sunday, get around the hospital on different wards, play the harp, and we would actually could palpate on the floor the serenity that would suddenly appear. Families who were calmed, their spirits lifted by this music. And now, a few years later, Ian is using this vibroacoustic harp therapy on palliative care patients for control of pain. He's expanded into treating other domains such as fibromyalgia, and with quite a bit of success. What we need to do from now on is be more objective and try to establish protocols where we can determine exactly who benefits and how they benefit and move on. So far, things are moving on. We're happy, and we're happy to have Ian on board.
My name's Ian Hepburn. I am a harpist and a piano teacher. So I decided that I would create a study into the effects of vibroacoustic harp therapy on fibromyalgia. So I set up a 10-session period that was to take place over 5 weeks, where a patient would receive 2 sessions a week, that we would track this with as much data collection as we could possibly do, so that we could see at the end of the session, and with a number of patients, were there common themes that were arising that we could say, this seems to be affecting a lot of people in a certain way. To sort of summarize, there was better sleep patterns, lessening of constipation in a number of the patients for whom that was a problem, certainly a reduction in pain, much greater sense of well-being, and by the 8th period, the 8th session and beyond, in many cases, a complete absence of pain. In the case of the patients who could not say that they were pain-free, they did say, however, that there was a great reduction of their pain levels, so that they were able to resume their lives in a much better way, were able to work in ways that they hadn't been before, and certainly a positive enough a result that we are going to extend it to involve more people, and I hope eventually in time that this will actually lead to a clinical study.
Yeah, now I feel it going down more towards my left leg for some reason. I don't feel it very much on the right side. as soon as I would feel like the lower tones, it was very intense and I can feel it. And as soon as that high tone would start, it was like, whoo, I'm floating on a cloud again and no care in the world. And after, it's just a feeling of complete calmness. And wow, you know, I'd be a hurricane outside and I wouldn't, you know, oh, that's nice, you know, like I feel very, very, very relaxed. Like I really don't remember the last time I felt so relaxed, and I'm usually a very nervous, high-strung person. So I would definitely do this again.
Diabetic. I have Crohn's disease. So I have to be very careful. I have no problem with my diabetes, and I can't feel my feet at all.
Have you been diagnosed with fibromyalgia?
One doctor told me that.
How about your hands and arms?
My arms seem a little looser. This one, well, I just can't move it. It's
there.
Well, maybe it's a little bit better. See, this is totally gone. It's just when the sound, it kind of just like went in. I could really feel it there.
Yeah.
Now, not pain, but it was maybe, I could say, a little bit uncomfortable. But there's so many things that I don't know if it's normal or not. But so many things went through my head.
Yeah.
Like I lost my grandfather. I was very young. And Mom.
It all comes up.
Yeah. But nevertheless, I feel relaxed, you know. Maybe it doesn't sound right in your head, but in mine, I think it's okay. Okay, I would definitely do it again, and some parts of my body really has, they did relax quite a bit. And like I said, this probably improved. Yeah, they're more flexible.
So Suzanne, how many years had you been suffering from fibromyalgia before you came to me?
Around 8 years.
So our last session would have been about 4.5 months ago. And so how has it been in that intervening time?
I never had no more swelling pain, no more shooting pain, and the only time is if I'm very tired at night. I will feel like the pain will come back, like in the beginning.
Yeah.
And then when I go to bed and it's gone in the morning, I don't have nothing.
This is not a toy that we're using. It is a really profound therapy. My own belief is that all things that we think are solid are in fact inert material being acted on by vibration, in which case we are vibration, and we are using vibration to treat vibration.